The U.S. has recorded another grim milestone in the COVID-19 crisis. The country has surpassed 200,000 deaths from the virus. That's the highest total in the world. More than 6.8 million people have been infected nationwide. Now researchers say the death toll could reach 378,000 by the new year. Mola Lenghi has the latest.
On the grounds of the Washington Monument today, 20,000 American flags remembering 200,000 American lives lost to the coronavirus.
And these flags are indicative not only of the lives lost, but of the families left behind.
Some well-known, others unsung. An American has been lost every 1.5 minutes on average since the first death was reported back in February. That's the equivalent of roughly the entire population of Salt Lake City, Utah, or Akron, Ohio.
The idea of 200,000 deaths is really very sobering and in some respects stunning.
America is accustomed to leading the world, but not like this. The U.S. has had more deaths than any other country. President Trump grading his handling of the pandemic.
Public relations, I give myself a D. On the job itself, we take an A+.
But the nation's top infectious disease expert seems to be grading on a different scale.
Take a look at the numbers and make up your own mind.
Health experts are worried about a resurgence of the virus as the fall season begins. 20 states, plus Washington, D.C. and Puerto Rico, are reporting increases in new cases from 2 weeks ago. It's been more than 2 months since we've seen cases rise this quickly. But it's the number 9 that has devastated Ricardo Aguilar. That's how many family members this small business owner from Phoenix, Arizona, has lost to the virus. 9 cousins, aunts, uncles, and less than 2 weeks ago, his father, Jose de Jesus.
I don't want to cry because, I want him to go in peace. And my crying is just not going to let him rest.
Ricardo's mother continues to recover from the effects of the virus. Meanwhile, new fears over an impending flu season colliding with the return of students to schools across the country. New research shows that an estimated 3,200 cases a day occur throughout the country that likely otherwise would not be happening if schools kept classes online. Elaine?
Mola Lenghi, thank you. For more, let's bring in Dr. Blythe Adamson. She's an epidemiologist and an advisor for the nonprofit organization Testing for America. Dr. Adamson, thanks very much for being with us. Part of what you do for Testing for America is to help increase the amount of testing for COVID-19. Talk to us a little about why testing is so important.
Tests are most valuable when they help us inform decision-making. And whether it's an individual patient and their doctor together trying to make a decision about what treatment is best for them, or an individual who has no symptoms, but they've been around someone recently who's been infectious, or they want assurance before going into a big public gathering or going back to work at a factory. It's really these individual decisions where results are most valuable. And then secondly, epidemiologists, public health officials also use testing to inform our policies and prevention strategies.
Well, where does the U.S. currently stand in its testing capacity, and is that an acceptable testing rate for a country like ours?
Well, there's no defined number of what is an acceptable testing rate. We're testing almost 1 million people a day right now, and really, we might not feel comfortable until there are no more COVID deaths. I think that one of the strategies we can use now is thinking about, where are we getting the most return on investment from our tests? And how can we be using them and stewarding the resources we do have available to get, the strongest economy and return to work and safe return to classrooms that's possible.
Well, school is back in session for students around the nation, and in some cases across the globe. Some colleges that were open for in-person teaching have now reverted to virtual classes due to outbreaks on campuses. How can these schools safely reopen without seeing a spike in cases?
It's it's pretty challenging. The most important thing is testing at re-entry of the students and the faculty when they're returning to campus to inform all of the isolations that need to happen afterwards, and then frequent testing going forward. And we've seen successes with some schools at a frequency of testing 2 times per week. One of the success stories we've seen is with Delaware State University, that's been able to bring students back and live in their dorms safely. There's just some randomness that happens with super spreading events, with 80% of transmissions happening as a result of 10% of the cases. And so it's so important that we have action plans in place so that when we do have a positive case on campus, we're assured that there is a safe place for those students to go, that they have housing security, food security, laundry services. And if colleges aren't able to provide this, then it could be dangerous and vulnerable to reopen if they're not ready.
We're also in flu season here coming up. How critical is it to get a flu shot? Because, a lot of folks may be hesitant to go into their doctor's offices to do that. And where does that fall with respect to importance regarding testing? Is it sort of an either-or proposition in your view, or do these two things sort of go hand in hand?
Well, flu tests and COVID vaccines are both important, and thankfully they're both available at your local pharmacy, at many pharmacies. So we need both of these hand in hand to have a successful fall and winter.
And COVID testing. Well, what steps do you think are needed to curb the number of coronavirus cases in the U.S. and return to some sense of normalcy?
Well, testing is important, but it's not sufficient to solve this. We need all of the things. We need everything working together and all of the people working together to get it done. So we'll have to have masks, distancing, moving as many events from indoors to outdoors as possible, and including strategic testing as part of that as we wait for vaccines. But we'll have to continue many of these efforts even once vaccines are available.
All right, Dr. Blythe Adamson, thank you so much.
Thank you for having me.